I'm Dr. Maureen McKenna. A topic that has gained a lot of recent media attention is the concern over the effects of concussions on children. Children who play high-impact sports, such as football, hockey, and even soccer, are experiencing undiagnosed concussions at an alarming rate, even at a very young age. A concussion usually occurs when a child receives a blow to the head, neck, or other part of the body. The blow causes the brain to move within the head and may or may not result in a loss of consciousness. After the injury, the brain releases many neurotransmitters, which overloads the system and affects the brain's ability to work properly. When a concussion occurs, the brain needs time to rest, both in terms of thinking as well as physically. Unfortunately, there is no imaging study which can diagnose a concussion. In most cases, the concussion diagnosis is made based on history and findings from a physical exam. Symptoms of a concussion include headache, nausea, sensitivity to light or sound, dizziness, or feeling off balance. They also include vomiting, feeling mentally slow, or difficulty concentrating or focusing. When a child receives a concussion, parents or coaches may observe certain behaviors. The child may appear stunned or dazed, they may forget instructions, be unable to recall details, have difficulty with balance, or be slow to respond to questions. If a concussion is suspected, it is important to remove the athlete from play immediately. They should then be seen by a healthcare professional within 24 to 72 hours and not return to play until medically cleared to do so. If the child loses consciousness, has a seizure, or experiences 2 or more episodes of vomiting, they should seek medical care immediately. This is also true if they experience a headache which worsens with time, or if they have slurred speech. Once a concussion diagnosis is made, the primary care physician will work with the patient and family to determine an appropriate plan for return to learning as well as play. The patient may need to stay home from school for a few days to give the brain time to rest mentally. Usually, academic accommodations may need to be made, such as shortened days, extra time to make up missed assignments, or rest breaks in the nurse's office. The physician will work with the school to make the necessary accommodations. Once the patient is able to return to school, a plan will be created regarding their return to play. Typically, there is a gradual increase in the intensity of physical exercise, which allows the coach, athletic trainer, or nurse to monitor symptoms. The patient should follow up with their physician to determine when the appropriate time is to return to contact play and gym. At each visit, a history and physical exam are performed. Neurocognitive testing may also be performed to help better follow the recovery process. At Washingtonville Pediatrics, we use impact testing for patients 10 years and older. Impact is a computerized neurocognitive test that was developed by the University of Pittsburgh over 20 years ago. It is used by youth sports nationwide, as well as the NCAA, NFL, NHL, and many other professional sports. The test looks at verbal memory, visual memory, processing speed, and reaction time through a series of 6 different tests. Since the test has been so well studied, there is a database on how a patient should perform on these tests, even when a baseline test hasn't been established. Many schools perform baseline testing on athletes prior to the start of the sports season, which provides the physician with a helpful comparison if the patient sustains a concussion. Washingtonville Pediatrics offers baseline impact testing to patients for a low fee, and we encourage it for all patients over the age of 10, especially if he or she participates in contact sports. Concussions can have a serious impact on a child's development and should be taken very seriously. Again, it is critical that the brain receive the appropriate amount of time to rest, both mentally and physically, before a child is allowed to resume normal activity. It is important to contact your physician if you even suspect your child may have experienced a concussion. Only a healthcare professional can properly monitor your child and provide them with an accurate assessment of their injury. As one of the Hudson Valley's only credentialed impact consultants, you can rest assured that at Washingtonville Pediatrics, your child will be properly diagnosed and treated if they were to sustain a concussion.